Retail pharmacy is in the midst of major transformation, from the AI revolution to the industry's push for PBM reform. At the NACDS annual meeting, DSN sat down for exclusive interviews with executives from some of the nation's top retailers to get an insider view of their market strategy and to ask what's on their radar for 2025 and beyond. My guest today, Angie Nelson, Senior Vice President, Pharmacy at Hy-Vee. Angie, thank you so much for joining us, visiting us here at Annual 2025. Reintroduce us to Hy-Vee and your footprint in the Midwest.
Yes, Hy-Vee is a grocery chain in the Midwest, and we have our retail pharmacies in 8 states. So Iowa is the main state, and then all the states that touch us. And then we also have the Strachan Van Til grocery chain banner that is located in Indiana.
Okay, so you mentioned the Midwest, and I understand that your footprint includes a lot of rural areas.
It does, yes.
And access is now an issue within healthcare. So how are you increasing access to those folks who live in rural areas out there in your footprint?
Yeah, so that is a huge focus area for us at Hy-Vee. We've always tried to remove barriers to care. And so a lot of ways we've done that through the years has been through our pharmacists really operating on the top of their license and really being involved in the community and to the care of their patients, really putting the patients as the center of their focus and really making any encounter with them the most that we can to improve their health outcomes.
Yeah.
But we've also did that with our dietitians and really providing access to dietitians, which can be, in some communities, there may not be any other access points other than maybe in a hospital setting. And so we really have unlocked clinicians in rural locations for many years.
Well, I'm glad you brought up dietitians because that's a good segue to my next question, which is food is medicine. And so I understand that you're setting up a comprehensive food is medicine program. So how are you increasing, improving outcomes for those folks?
Yeah, so as I mentioned earlier, we really have had our dietitian program and we've had our retail pharmacies for over 50 years. And so really we're working to further tie those along with our grocery that we've been selling for 90 plus years and tying those all together. We're the perfect intersection of where we can utilize all of those strong assets to improve the health outcomes of the patients that we serve. So our focus and our mission at Hy-Vee is making patients' lives easier, healthier, and happier. And so we're really able to do that with that entire food is medicine program that really ties everything together and really makes it a seamless process for our patients.
So we often hear that partnerships is the way to go. It's the future, essentially. What kinds of partnerships are you forming, and how does it position you for future pharmacy?
So it can be anything from what we've done in the food is medicine space, where we partnered with Soda Health to be that fintech solution so that we have the payments solution for those types of programs. It can be with our recent announcement with GoodRx, where we now have the ability for a customer to go on their website, check inventory, and be able to prepay for a prescription before they come to our store. Another really good example of that is our newest endeavor in the primary care space. And so Hy-Vee Health Exemplar Care is our newest venture, and that really is a direct primary care model that individuals, families, or employers can purchase direct primary care memberships and receive really unrestricted access to primary care. They can urgent care and some labs and some X-ray type services. And really that just is allowing patients to seek that transparent, affordable healthcare solution in a lot of the communities we serve.
Great. Angie, thank you so much for visiting with us.
Thank you.
Appreciate it.